confident that over time we will reduce those waiting times and improve the services available to young people.
Question number 16 in the name of Benjamin Cosford.
Thank you, Mr Speaker. To the Health Minister, the Honourable Andrew Little. Why is it that the New Zealand Ambulance Service only receives partial funding from the government and instead has to rely on donations from the public to get by?
Mr
Andrew Little.
Speaker, when the member refers to partial funding, which was in the original lodged question, of ambulance services, he should be aware that the $255 million we will provide this year for ambulance services is the vast majority of funding required for those services. At this point, the approach we take for funding ambulance services is we agree on a 4-year funding contract with our ambulance providers, St John's and the Wellington Free Ambulance Service. That funding comes from Te Whatu Ora Health New Zealand and ACC. The last 4-year contract ended last month, and during that 4-year period, ending last month, we provided additional funding outside the contract to ensure the services had the support necessary to do their job. We are close to concluding a new 4-year agreement with ambulance services. In this year's budget, we have provided an additional $166 million over 4 years to enable the ambulance services to add 48 new ambulances, 13 other rapid response vehicles and 248 crew to their operations. The ambulance service providers have not sought full funding because they provide services other than ambulance services, such as first aid training and event support, and they are charitable organisations. To maintain their charitable status, they have to demonstrate that they receive charitable donations.
Supplementary question.
Supplementary question. How many individuals, if any, have suffered from serious health conditions because they were not in a financial position to call an ambulance?
Mr Speaker, I'm not quite sure what information the member is referring to base that particular question on. The ambulance services are available. They are an emergency service. If somebody is injured as a result of an accident, then that's a cost that's picked up by ACC. If they are suffering the effects of a chronic condition and they call an ambulance, the priority is to get the ambulance there and get people the treatment that they need. It's fair to say, I think, partly as a consequence of COVID and the impact of the flu seasons and respiratory conditions that some people suffer, some people call an ambulance when they are feeling a level of distress, and so the demand on ambulance services has been quite considerable this winter as it was last winter. That has meant ambulance services triaging their calls, and obviously priority goes to those who are at risk of life and limb. That has pushed out some waiting times for some people. But it's because of those waiting times and the resourcing that the ambulance services have said they need is the reason why we funded them to acquire additional ambulances, but most importantly the crew to go with them, and those will be coming on stream over the months to follow.
Further supplementary.
How does the lack of full funding within the ambulance service affect staff shortages, and what plan, if any, does the Minister have to address staff shortages within the ambulance service?
Mr Speaker, I refer the member to the answer to the primary question. So in this year's budget, we provided additional funding for the ambulance services to procure additional ambulances, as well as the crew to go with it. So 248 additional crew deployed around the country. So the relationship between now Te Whatu Ora Health New Zealand and the ambulance services is a very strong one, it's a very close one, and they work closely together. When the ambulance services consider that they are under pressure, they have gone back to the funder. Previously it was the Ministry, and we've worked out arrangements to make sure that they're getting the support that they do. This is a vital service, a vital part of the health services, and we support our ambulance services to do the best they can.
We come to question number 17 in the name of Mitchell Atkins.